to tell during the training is the patient expectation. So sometimes when you have a patient ask about it, they might not know exactly what nitrous is. So letting them know that it's not in place of the pain medication. So if their pain's a 10, it will still be a 10. It's just that it will help them cope, take the edge off, things like that. I think talking about that first, I think their experience will be a lot better. So obviously for labor and delivery through contractions, other procedures I'm sure you guys use it for, repairs, things like that, it really can be used in any capacity. So you want to roll this in and get the demand valve from the Pyxis. And so this is basically your safety. So the device is not going to work without this. So here we go. Oh, that really pushed it in. I was having a hard time. So you just want to tighten this here. Here we go. Huh? You're watching me fail at this miserably. There we go. And then you want to take this little hose is always going to be attached to the device, and you want to hear it click. And then the only two things that you actually have to hook up are the wall oxygen.
I'll finish this one while you get
Okay.
going.
And then the vacuum hose. So you'll start to hear a hiss, that's normal. Hi. And then you'll want to get these two disposable pieces. So they're separate pieces, but you have your mask and your circuit. So where the T meets is where you connect it to the demand valve right here. And then you just want to place it here while you get everything else ready. So this pink tube is basically where you're going to connect it to the vacuum. So the top here is where you're going to connect to the vacuum. And then you want to open your nitrous tank. Just keep in mind there's no sequence as to which to hook up first. Just you can use it to your discretion. So you want to take this wrench and open the tank. So it's counterclockwise. So you just want to crack the tank open. Just a quick turn there. So for nitrous, just a rule of thumb, it is a liquid inside. So your gauge up here is not going to indicate if it's empty or full, like an oxygen tank. So the average continuous breathing rate allows you to have about 13 hours for one tank. So once you have it on your patient, what you're going to have to look at is the policy will state that you're supposed to be with your patient the first 15 minutes. So when they start taking their first couple breaths, if for some reason you either didn't open the tank correctly or there's nothing left in the tank, this will actually drop down to 0. So you don't have to disconnect anything when you're changing your tank. You can just keep it as is. So the last step is turning the basic vacuum on. So the ball valve right here is in this 9 o'clock position, so that's off. And then when you're ready to use it, it's going to get louder, but you know that the vacuum is basically on and ready to remove the exhale breath. So now is the time to have your patient start breathing in and out. So you just want to have a tight seal over the bridge of the nose, under the mouth, and a long, deep breath. Inhale, exhale, repeat, repeat, repeat until they get tired, basically. So if you brought the device in a little bit too early or they want to take a break, you don't have to actually unplug anything because there's no flow coming out of here. It's a demand valve system, meaning that the mixture is only coming out when the patient inhales. So once they start breathing room air, it will reverse its effects. So any possible side effects would be dizziness, nausea, things like that, and they would subside once they start breathing the room air. So that's basically how to connect it. And once you're all set and ready to discontinue it, again, no sequence as far as how to, what steps to take. It's really just whatever makes most sense to you. So you want to throw those away. I like to take out the demand valve next. So loosen it, the side, and then there'll be like a little metal clip, just do that.
That gets returned to the Pyxis.
That gets returned to the Pyxis, yep. Hang on a minute. Maybe that kind of went way too.
It's good to see a little struggle.
Yeah.
That way people know it's not necessarily super easy.
Why is that?
It's the story of our lives.
Yeah, I know. I think I just put it in too tight now.
Alright, we get the idea.
Yeah, I'm gonna
Alright,
play around with
and
that
then-
in a minute. And then you just want to unplug the hoses. And then a best practice just finally is to close your nitrous tank. So just close it, and then you're good to go. Okay, and that's it.